Welcome, everyone, to A Mexican Crossing Lines with your hosts, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPP LP Fargo Moorhead, where we are adding local color to your airwaves. Tonight, in our continued reporting on the pandemic, I'm going to be discussing the topic of blame. Blame Game is the name of my show, and I'm going to be telling you about the blame game and how people in this country and around the globe are all trying to point the finger at someone who is really responsible for the deaths, because we are all traumatized by this pandemic, not just physically, but emotionally. Our economies are being crippled. There is a lot of anger. And when horrible things happen, part of the stages of grief that we go through when we are traumatized is finding out who done it. Who is responsible for this? Who do we need to blame? So we're going to talk about how that's happening to us as a country, as leaders in this country are pointing the fingers at who is to blame, because there is a lot of suffering, there is death, there is economic decay, and people need somebody to point a finger at and blame and get their anger out. Maybe it's just human nature that we need someone to blame, someone to punish. Someone has to pay for this. What's happening to us, to the world. And I want to bring it back. I don't want us to be distracted by all of the pointing fingers. I want us to bring it back to the origin. And for that, to that end, I will be translating once again a video of Yuan Li, a Chinese man living, I believe, in Spain. He has been exposing the Chinese Communist Party and the actions of the leadership of the Chinese Communist Party in hiding the pandemic from the world and infecting the world, what their aspirations of world domination mean for the rest of the world, etc. All of that we will be covering today, as well as a look everywhere, locally, nationally, and around the world, to see what's happening with regard to the pandemic. But first, I want to thank all of the people that have sent me information, links, comments. I'm always interested in hearing what you all have been going through, have to say. So thank you for all of your messages, emails, phone calls, etc. I will be responding to some of those on live air. If you want to join the conversations, follow our social media, and of course, please help to support local low power FM community radio by making a tax-deductible donation today.
That's right. If you'd like to do that, you can go to kpppfm.com and go to the donate tab and make a donation, and it's tax deductible, as Cindy said. We'd like to thank everybody for joining us and also sending information. We get a lot from people, and sometimes we don't respond. We do read it all. We eventually get to it. Sometimes we give you a response. Sometimes it just kind of goes in the hopper and we use it. Sometimes we bank to use it. So you're doing a great job. And for those of you who'd like to send us information, we have many ways to do it, and I'll go through a few here tonight. One is a message line that you can call in and leave a message. 701-566-0917. 701-566-0917. You just call in. You can leave a message up to 3 minutes. We might put your voice on the air. If you don't want to do that, you can email us at cindy@kpppfm.com or me, Duke, at kpppfm.com. Also, you can go to Facebook and use old-fashioned Messenger. It seems unlimited for how many messages you can put through. And you can do attachments and videos and all that with Messenger. And find us at 88.1 Fargo Moorhead Radio, Mexi-Can, and the People's Press Project. And when you go to kpppfm.com, just look around. We have our shows there. And also we have a YouTube channel, Duke 1517. And that's where you'll find playlists for these shows and all Mexican Crossing Lines, plus some of the other videos we do. It's Duke 1517. Thank you. It's going to be a doozy of a show tonight.
It's going to be a good show. I have a lot to say about what's happening in terms of the blame. And I want to start off by saying that when I first saw people protesting to reopen their governments in the midst of the highest daily numbers of death in our country, which now exceed 50,000 people dead, I knew that it was going to be the start of something, the beginning of something. And when President Trump got very angry at the press and said that he was going to reopen the economy and he had the ultimate authority to do so, I feared that in order to fulfill that promise, to make good on what he says he has the power to do, that we would see an outbreak, pardon the use of the word here, but of protests, many of them looking more like Trump rallies, and than real protests, but all over the country to pressure the governor and to artificially make Americans think, wow, everybody seems to want to go back to work now, so I guess I'm being silly if I stay home or if I wear a mask. Folks, and it is just that. It is artificial. It's not real. It doesn't reflect what 80+% of Americans want, which is for us to maintain precautions until we manage to flatten the curve safely, then safely returning back to our lives in a slow, paced out, very careful manner with the backup of extensive testing and tracing so that we don't have massive losses of life. And yet, I know that what this is really about is blaming, shifting the blame, such that when we have another spike, and mark my words, we are going to have spikes, outbreaks, the collapse of healthcare systems, even in rural communities, or maybe even more so in rural communities, and I'll explain why that will come to pass in a town near you. Because we had these protests, and because we're having these protests, because of the rash of protests, we will have outbreaks. And the most vulnerable and the most sick will die, and we will be overwhelming our healthcare systems in a way that was completely unnecessary, a self-inflicted wound. And then at that point, when people are angry, when people start getting out their pitchforks and their torches because grandma's dead, because grandpa's dead, because Billy died, because Susie died, because your favorite math teacher died, because the basketball coach died, because your pastor died, and they want to go back and say, Tim Walz, Governor Walz, Governor Burgum. Those are our Minnesota and North Dakota governors. Or whatever, insert the name of your governor there. This is your fault. You have blood on your hands. The governors can say, nope. I was giving you health guidelines you were supposed to follow, and you guys picketed me. You guys protested this. You defied the laws. You defied the rules. You went back out into the streets. You tied my hands. I mean, there wasn't a lot I could do. I had to go out there. I had to let you do it because basically the alternative was to throw all of these people in jail during a pandemic, which would be just as colossally stupid. So, not my fault. Sorry, you're all dead. Sorry, you got so many people sick. When the nurses, when the doctors, when the police officers, the EMTs, the paramedics, when they clamor, when they yell, that the governors, the leaders have failed them, have failed their families, have failed to protect them. The most important people, the people we are calling heroes every day, every single day. The governor will have someone to blame. And it's going to be those people in the street protesting. I'm sorry. I wanted to keep that up. But the people of the state wouldn't let me. And it takes the pressure off of the governors. It takes the pressure off of our president. Hey, have you listened to the pressers with the president? What's the tone? What are you hearing? What is he saying? Hey, I think, it's very patriotic. People are protesting. It's their right to do that. They have a right to protest. I think it's fine. And, some of those governors are excessive. Not letting people buy plants and seeds and things like that and for their lawn. I mean, That's ridiculous. So he agrees with it. So he thinks it's okay. He doesn't have a problem with it. Thinks it's patriotic. Lots of flags. He likes that. Who doesn't like a parade, right? With flags. Come on.
Yep.
Good stuff, right? But at the end of the day, when the bodies start piling up, when things go sideways, when the you-know-what hits the you-know-where, that's when people are going to demand justice. That's when people are going to demand an accounting for the loss of life, for the pain and suffering, for the horrible damage. And oh, by the way, everyone go back into quarantine. We are literally shooting ourselves in the foot because we're going to have to go back in quarantine because it's going to become painfully obvious that if we don't, we're going to have a massive amount of death. But that's not going to happen right now. It's not going to happen today as people are parading around protesting their local governments. It's not going to happen while they're honking their horns, driving down the street. They're not going to collapse right there. It's going to take days. For some people, it's going to take weeks. So that we're going to see that snowball effect. It's not going to happen right now. It's going to happen in the future. On the same day that I last reported that we had people protesting in front of the governor's mansion in Minnesota, on that same day, the head of Nursing Association, I believe, was reporting, I think it was in Minneapolis, that their entire floor that they had set up to see people that were intubated in ICU for COVID was full. And they were weeks away from hitting their peak. She said this with tears in her eyes on the same day that she had a bunch of buffoons outside risking their lives and the lives of people in their community. And folks, I want you to think about how sad it is that we have folks that are projecting this idea that there is an acceptable amount of death. And we know who primarily will die. People that have underlying conditions like diabetes, people that are being treated for cancer, people that are at higher risk because they wear CPAP machines, because they're obese, because they have underlying heart conditions, right? Older people. And you know what? It's acceptable. We think it's okay. Let grandma die. Gonna have to have some death. You know, grandma's had a good run. She lived a full life. You know, it's time for her to go. For the rest of us can go and get our hair done and get our massages and go to our lake houses again. Right? So we can go and have pizza. Go and sit down at the bar and have a beer together.
Definitely.
I want to go to the microbreweries again. Right?
Yeah. Just go do karaoke.
So here's the thing. There will be a reckoning. This isn't hyperbole. This isn't metaphoric. It's going to happen. This is just science and math, and it's going to be happening in a couple of weeks and over the next month. What we have done, seriously dangerous, in my opinion, ludicrous. And we are going to pay a heavy price. Meanwhile, know this, America. Know this. We are not alone in our insanity. Other countries are doing the same thing. Unfortunately, we are all in this pandemic in a shared psychosis. None of us on this planet know how to deal with this pandemic. None of us on this planet know how to react to it. We're all traumatized by it. The ever-present possibility of death. And how do we go about surviving it, overcoming it, living through it, continuing to have some semblance of normalcy in our lives, and hopefully holding on by a thread to our economies. It's going to be really tough, guys. But there is a way out. There is a way through. It's the hardest. It's not the easiest way. It's the hardest way. And it requires patience, and it requires a lot of sacrifice, but not of lives. It requires us to sacrifice by staying inside. It requires for us to continue to keep our businesses closed or to a minimum, only those that are essential. It requires for us to make sure to protect the elderly and the vulnerable, not to put them in line to die first, but to keep them out of harm's way the longest. To sacrifice the people that are the youngest and the most robust of health to go and do the jobs and keep our essential work going, so that the vulnerable and the most the most aged in our society don't have to. So let's look at the world numbers right now. Let's take a look at the world numbers. We are up to, well, at the time that we took this photograph, the numbers were lower. By the way, we've tested over 4 million people now in the U.S. Still a very tiny percentage. I mean, that's a lot. A lot more.
Yeah, but not compared to the actual population.
No. Total confirmed cases are at 2,472,259. Let's look at some of these countries real quick. The U.S., of course, is leading with almost 800,000 cases. In Spain, they have over 200,000. In Italy, they have 181,000. France has 156,000. Germany has 147,000. The UK has 125,000. Turkey has 90,000. China, And of course, we don't believe these numbers, but China's at 83,817. Iran is at 83,000. Russia's at 47. And Brazil, I want you to remember that number for Brazil, is at 40,743. Brazil is a huge country, has a gigantic population, okay? Brazil is a huge country. Their numbers may exceed the numbers of contagion in the U.S., in my opinion, okay? That's how big Brazil is. But I guess we're going to see. I want to share the U.S. numbers with you. What we have for the U.S. numbers is 792,759 cases, 42,514 deaths, 72,389 people recovered. The states, let's go to the states. We have New York at 252,094. New deaths, 31, excuse me. New Jersey is at 88,000. Massachusetts, Pennsylvania, California, Michigan, Illinois, Florida, Louisiana, all above 20,000 cases. Texas, Connecticut, Georgia, they're almost at 20,000 cases.
Wow.
Ohio is at 12,000. Maryland is at 13,000. Washington is at 12,000. Colorado has exceeded 10,000. Indiana has 11,000. Where is Minnesota and North Dakota at right now?
Well, it goes up every day, but, it's not a good thing. But for a smaller population in Minnesota, there are 2,356 confirmed cases and 134 deaths. In our local county, Clay County, where we live, there's 43 confirmed cases and there's been one death. And in North Dakota, their numbers are, keep on climbing. I mean, they have 627 positive, but there's been 42 individuals who tested positive in one day, just in one day. And 17 currently hospitalized, 189 recovered, and there's 13 deaths. Actually, 3 people died in the past day, and all 3 of them were from Cass County. And a man from his 70s had underlying health conditions, and a woman in her 80s, and a woman in her 90s, all from Cass County, passed away yesterday. So the numbers are 13 dead. And in Cass County, the positives in just one day were 34. So I keep on talking about Fargo has not done the distancing and the things they really, really need to do, and that's increased our numbers. And as we look at the protests and that sort of stuff, it's going to have that sort of effect. That's not good. It's just horrible, actually. See, I'm having trouble with my thingy here.
And we also had a new case of another COVID case in a nursing home.
Yeah.
What are you looking for? The Minnesota cases by county?
No, I can't get the thing to shut off.
Oh, that's too bad.
Yeah.
So, there you go. Facility so that's the one maybe for that one? No, that one? Yeah. Whoa. That's a little glitch here.
Yeah, there's a glitch.
So, what if you just go to the next one? There we go. How can you hide it?
I don't. Here, why don't you stay on camera and talk with the folks a little bit and let me have
All
a
right.
look at
Well,
this.
we have a new case at Eventide in Moorhead.
Mm-hmm.
It's very interesting because that case was only reported in one story in our local newspaper. And interestingly, the case of COVID there is at the same nursing home that first reported that they had a case there 11 or 12 days ago. So there was an outbreak at the Fargo location, which was 10 cases altogether at the Fargo location, plus the original case at the Moorhead location 12 days ago, and now a second COVID positive, and I believe this time it is a resident,
Yeah.
not a staff member, as was the first original case that came out of Eventide. And let me just share with you from the tracking project. I'm gonna answer some of your questions, talk to you about some of your comments and questions real quick. Okay. Sophie comments, I do wish people would trust President Trump's plan and then open up slowly and cautiously. I do see some states going overboard. I haven't lived it because in my area, we are not locked up, but still people are follow safety. I hate to see some say less Trump supporters. They are saying that those people will not be around to vote for Trump. Did someone incite this to happen too early to harm us? I don't know. I mean, I don't think that it's good for anybody. It makes me sad that a lot of the people that are out there appear to be or are being called Trump supporters, but whoever gets sick and clogs up our healthcare system is, who is going to end up paying the price for this. And that's very, very sad.
Yeah, for sure. Well,
What's going on?
I figured out, had a little glitch there, but I had to show you the news article around Eventide because I've been saying something almost every day about it because I don't like the way that they're really handling it, and I'm not the only person. They just had 10 people become positive in the past couple of days, and the Moorhead one had been resisting telling their numbers, and they really don't want to talk about it, and they're actually ordered to now, and in fact, there's a resident of another nursing home. Her name is Jody McLaren, and she's blind, and she lives at the St. Francis facility. It's not an Eventide, but it's another one. She said, "Are we all going to get sick? What are we supposed to do? Everyone's wearing a mask," she said. McLaren said that lack of transparency has been concerning. I wish they would just tell us a bit more so we're kind of in the loop, she said. She said staff members have been wearing masks and residents are isolated in their rooms, yet she wishes more was being said.
So even the people within the facilities, they don't feel like they're being told
they're like
everything that's going on.
It's like, they're almost being lied to or it's not told. And they don't want to be left in the dark. And they're worried about their bottom line and all that stuff. It's like, but, they've got to do better. They got to report,
Mrs. Red Badger says, we can't hide forever. This is true.
Yeah.
I agree with you. I'm not disagreeing with that. But I think that to do things in a reckless fashion is not a good idea.
That's true.
Empress Latesse says, wait, throw them in jail? For what? They were exercising their constitutional right, so he couldn't throw them in jail if he wanted to. Well, I mean, technically he could. People are getting thrown in jail. And if people that are not following the distancing rules or whatever, people are getting arrested at some of these protests. I showed that to you in video. So technically speaking, yes, they could be arrested and they could be thrown in jail. But I don't think that that's a good idea either because you can't social distance inside of a jail cell with a bunch of other people. I mean,
yeah.
Like,
and plus you got to think about what this protesting that. What are we protesting? That we don't like the governors making us stay safe and not catch this virus? So you want to go out there and say, yeah, go ahead and protest. Just go ahead and do that and put other people in danger because this thing's spreading fast. And maybe you're a denier, a COVID denier, and don't think this thing exists. And you're going to protest so you can go back to work and go to McDonald's and do all this stuff. It's it's stupid. I think it's horribly dumb.
What we're doing in North Dakota doesn't even make sense because we got people protesting that the governor. What? He didn't ever close the state down, really.
Yeah.
I mean, some businesses were asked to close, like tattoo parlors
and the bars.
And bars and places where they have direct contact with people, like dentists and things like that. Mm-hmm. But for the most part, everything else is open. The governor already announced, like so many other states in the Midwest, that they were going to be reopening slowly all these other things.
Yeah, in 10 days.
And already. So what's the purpose of that, really? Doesn't make sense, right?
No.
Except if you think about what I just told you, which is blaming. Who are we going to blame?
Yeah.
And if and when, I should say, when you start having a pileup of dead bodies in these states, people can't turn around and point their finger at the governors and say, this is your fault.
Yeah.
Who cares whether or not people were protesting and saying that they wanted it to be open? You should have not listened to them. You should have kept them safe. You should have done what was the most prudent to save lives throughout the state. But the fact of the matter is, not all governors are going to do that.
No.
I'm guessing most of them are going to bend to the will of the businesses and the people that are clamoring to go out. That's what my gut is telling me. They're going to bend. They're going to break. They're going to go ahead, and they don't care. They don't want to do this in 10 days. They don't want to do it at the end of the month. They want to do it right now. That's the problem, folks. And somebody said, "What is the problem?" Colleen says, what is wrong with being in your car?" Nothing is wrong with being in your car, but a lot of these people weren't in their cars. And a lot of these protests, there was like bunches of people shoulder to shoulder. They're not taking any precautions. People aren't wearing their masks. Come on. They're not even wearing masks.
We're going to show you some of this.
They're not going to try. Yeah, I'm going to let's go to the evidence. But first let me talk to you. Okay?
Yeah.
First let me talk to you about this article I'm going to share with you that comes out of the new statistics that reveal why America's COVID numbers are flat. Few figures tell you anything useful about how the coronavirus has spread through the U.S., but here is one statistic that does. And that is our test positivity rate, it's called. Do you know about that, Duke?
No.
What the test positivity
what is
rate?
that?
Let me explain it to you. Okay. Remember that tracking project that tries to figure out how many cases we have?
Mm-hmm.
Okay. According to the tracking project's figures, nearly 1 in 5 people who get tested for coronavirus in the U.S. are found to have it. Okay. In other words, our country right now has a test positivity rate of nearly 20%.
Okay.
And that is very high, according to Jason Andrews, an infectious disease professor at Stanford. Such a high test positivity rate almost certainly means that the U.S. is not testing everyone who's been infected with the pathogen, because it implies doctors are testing only the people with a very high probability of having the infection. People with mild symptoms, to say nothing of those with no symptoms, are going undercounted. Countries that test broadly should encounter far more people who are not infected than people who are. You feel me?
Mm-hmm.
So their test positivity rate should be lower, not high.
Okay.
The test positivity rate is not the same as the proportion of COVID cases in the American population at large. That is another metric called prevalence. Nobody knows the true number of Americans who've been exposed or infected with the coronavirus, though attempts to produce much sharper estimates of the figure through blood testing are underway currently. Prevalence, this other metric, is a crucial number for epidemiologists, in part because it lets them calculate a pathogen's true infection fatality rate, the number of people who die after becoming infected. But the positivity rate is still valuable. Quote, "It's not a normal metric, but it can be a very useful one in some circumstances," Andrews says. The test positivity rate is often used to track the speed of to track the spread of rare but deadly diseases such as malaria in places where most people aren't going to be tested.
Okay.
And if the same proportion of the population is being tested over time, the test positivity rate can even be used to calculate the contagiousness of a disease. Because of the number of Americans tested for COVID-19 and how that's changed over time, the U.S. test positivity rate can't yet provide much detailed information about the contagiousness or the fatality rate of this disease, but the statistic can still give us a rough sense of how bad a particular outbreak is by distinguishing between places undergoing very different sizes of epidemics. A country with a 25% positivity rate and one with a 2% positivity rate are facing vastly different epidemics, he said. And the 2% country is better off. In that light, America's 20% positivity rate is very disconcerting. The U.S. did almost 25 times as many tests on April 15th as it did on March 15th. Yet both the daily positivity rate and the overall positivity rate went up in that month. If the U.S. were a jar of 330 million jelly beans, then over the course of the outbreak, the healthcare system has reached in with a bigger and bigger scoop to get more jelly beans out. But every day, 20% of the beans it pulls out, no matter how much bigger the scoop is, 20% of those beans are still positive, even as we're getting bigger scoops out. If the outbreak were indeed under control, then we would be expecting more testing of each scoop, that is, a larger scoop, to yield a smaller and smaller proportion of positives, percentage of positives. So far, that hasn't happened yet. So, in an ideal testing regime, and in any of the testing regimes that experts say must exist before the U.S. can end the lockdown, anyone with a fever and a dry cough would get tested immediately. A very large portion, if not most of those people, would turn out to be not infected with the new coronavirus, SARS-CoV-2, because humans are susceptible to many other respiratory infections. But when tests are rationed so strictly, only people with very severe symptoms make it into the testing pool, ensuring that the positivity rate will be extremely high. Local rationing rules are not the only reason that Americans are not getting tested. Some people live in places that are not doing much testing at all, either because doctors' offices have no tests to offer or because of an already strained or non-existent local healthcare system. Others avoid the doctor if they're sick or never get sick enough to go get a test. But if the U.S. were testing more people, and experts say that it has to, then the general population surveillance or workplace testing could detect their illness too. The test positivity rate then is a decent, if unusual, proxy for the severity of an outbreak in an area, and it shows clearly that the U.S. still lags far behind other countries in the course of fighting this outbreak. South Korea, which discovered its first coronavirus case on the same day the U.S. did, has tested more than 500,000 people, or about 1% of its total population, and discovered about 10,500 cases. The U.S. has now tested 3.2 million people, which is also about 1% of its population. But it has found more than 630,000 cases. So while the U.S. has a 20% positivity rate, South Korea's is only 2%, a full order of magnitude smaller. I hope that gives folks an idea of how far we are from where we need to be in order to be going back to work and opening up our economies safely. Safely. Okay. Now, Rachel Fox comments, yes, you're absolutely right. I'm in Knoxville, Tennessee, and I've got friends that are coughing, sneezing, sore throat, and they want to get tested, and they told them, no, basically, you have to be dying. And now YouTubers only letting you say like 100 letters, and it cuts you off. And now, like Twitter. Second part is you have to be dying in Knoxville, Tennessee. A doctor at UT Hospital told me I'd have to go to the emergency room, pay for it, and they might or might not test me for COVID-19. Wow. Love my puppy comments. I live in a resort community on a lake. We had to close off entry because people are more concerned with wanting to vacation during their time off. We will not risk the safety of our elders. Thank you for your comment. Empress Latesse says Bill Gates and Anthony Fauci used our tax money and funded China to create COVID-19 coronavirus. Now they want to force vaccines and then make us get a digital tattoo. Okay. Well, I would what you claim there. I don't know about that. Let me go over to my other comments here. Jerry Lee says, I blame China, where they keep it quiet for 3 weeks and did nothing. Well, we're going to hear more about China in just a moment. Folks, obviously, the more tests, the more cases we're going to have, right? And we have positives that are leveling off, but the reality is that they're leveling off because we are not testing enough. That's the reality. So we have to get to the place where we're actually testing more and more people. And that's what's really going to keep us safe and allow us to go back. Now, early signs of a flattening could turn very deadly, as Dr. Birx has said. She said, so if people start going out again and not socially interacting, we could see a very acute second wave very early. We're really encouraging every American to continue to follow the guidelines for these 30 days. Is that happening? No. And let me show you, this insanity extends to the rest of the world. This is what's going on in Brazil. I'm going to have you read the words, dude.
Okay. I believe in Brazil. Lots of people, huge crowd.
That's the president of Brazil.
Okay.
With the crowd.
We don't want to negotiate anything. We want is action for Brazil. The president of Brazil. The old ways will stay in the past. We have a new Brazil ahead of us. Everyone from Brazil, with no exception, must be a patriot and believe and do their part so that we can put Brazil in the place it deserves. People on motorcycles on the street, they're honking, I would die from COVID to defend my country. We have to work responsibly, health and the economy. People cannot die of hunger. This person has a noise maker. People over 60 should stay home.
People who don't have problems at all, we should go out and work. We have to get moving.
We want to work. Wow, that's wild.
That person said, I want to die of COVID-19 for my country. I would rather die.
I'd rather die, okay.
Of COVID-19 and be a patriot for my country. Sound familiar?
Yeah.
That's exactly what we are seeing in the United States right now. Look at this video in which, and this is in America, okay? This is from the last couple of days of protests, and people are saying the pandemic is not even real. Oh. Listen for yourselves.
There's no pandemic. Media is the cancer.
People are going to die. They die no matter what.
Here are the people protesting stay-at-home rules.
I need a haircut. Yes. That's great.
For heaven's sake, open the barber shops. Open the hair salons. We need haircuts, okay? We got to buy food. We got to go to work. We got to provide for our families.
Are those people staying in their cars? No.
7 weeks, COVID-19 has killed more than 37,000 people.
It comes to the pandemic, are you scared at all? Do you believe in it?
Yes,
Oh, yes, I believe
we
it's
sure
real.
do. Exactly, it is real.
We still have a right, I think, to
To work.
We have a higher power that we believe in that takes care of us, and I know that it's a real thing. The pandemic is a real thing, and we do believe in that.
It's not
But we
fake,
want
but
to work. We want to work. We don't want a government handout.
Almost none of the street protesters Thursday wore masks or physically distanced, as the CDC recommends.
No, we aren't. We aren't. We're not scared of this virus.
COVID spreads across the country. Health experts push for stay-at-home rules to slow the rate of infection and prevent health system
God
collapse.
bless America.
Where's the circus? It's in that building right now. Where they're pretending that we need a social distance. Where they're pretending we need masks. They should wear the mask.
Are innocent until proven guilty, which means we do not need an immunity certificate. We do not need a test to prove that we're not vectors of disease and out walking around.
People with COVID-19 can show no symptoms, but still infect others.
We can make our own health. You don't need to be our deciding factor on when we go to the doctor. We can't get to the doctor right now because you got it all clouded up with corona. It's not all about corona. It's about cancer. It's about all these other diseases and all these other illnesses. People being put on hold for surgeries and stuff because you need to open it back up and let us be our own choice, our own voice.
Can I see the back of your vest? So this is Bikers for 45. He's the president of the Minnesota chapter.
Governors say that they are desperate to reopen their economies, but are held back by a continued shortage of COVID-19 tests, which are needed to quickly identify and contain new outbreaks.
If you can't make the choices for yourself, you no longer live in a free country. And right now, we do not live in a free country. We have to wait for permission from the government at many levels to be able to do something. Go out of the house, go shopping, gather in groups of 10 or more.
Men and women are tyrants! My husband and my son were confronted by the police last week for simply trying to make a living, all the while these politicians are being paid from our tax dollars! They are suffering! They are suffering! We are suffering! This is an uprising!
Doctors say crowds like these could reverse a fragile
we have
recovery.
examples. We had a church gathering here in Kansas that had 50 people infected, 6 deaths, and they went to 9 counties so far, and with the illness, and have been. That's how the spread occurred.
Have you considered the health ramifications of being in a large group of people?
Yes.
And that doesn't change your mind?
No.
Why do you think the doctors are saying that?
They don't have any choice. Of course they have to say that.
USA! USA! USA!
So
Wow.
you want the people to treat you at the hospital when you get sick, when your family members get sick, when your grandma is dying. You want the emergency rooms to take you, to care for you, to hold your hand, to intubate you, to breathe for you when you can't, to give you the medicines that you need to live. You want them to do it under the most horrible of conditions, under the most pressure of conditions. And at the same time, you don't believe them, and you want them to fire Fauci. Do you want them to fire all the doctors that are at the clinics, at the hospitals, telling you to please stay home? Also, are they also Nazis? Are they also fascists? Because are they also tyrants? Because they're begging you not to make it impossible for them to save as many people, not to make it impossible for them to have enough ventilators, to have enough equipment to deal with the influx of people that are sick and dying. I mean, this isn't about whether or not your paternalistic government is telling you when you can go shopping and when you can get your hair done. It's not about that. It's about life saving. Okay? Let me read some of the comments. And why are they not spraying our streets and disinfecting everything like China and South Korea are doing? That's another question. Rachel Fox, that is a great question. Omega Man says, we want. Nature don't care what you want. Thank you, Omega Man. I agree with you 100%. Nature doesn't, the pandemic doesn't care. The pandemic doesn't care. The pandemic doesn't care whether or not you believe it's real. The pandemic doesn't care whether or not you think that doctors are lying to you or they don't have your best interest at heart. You can't have it both ways. Amanda says we need to be able to feed our kids. Agreed. I agree 100%. And the government, our communities have to find ways to make sure that we can. If there are people that are going hungry, if there are people that are starving or dying, I want to know about it. I need you to send me those stories the minute you hear them, because we have to spotlight that and make sure that those people are heard and that we get help for those people immediately. Okay? So anybody that has a story out there of people that need help, especially if you're in the Fargo-Moorhead metro area, let us know so we can get you that help. Okay, we're going to be a community that stands together and that helps each other. And for those of you out there that are saying that these people that are outside protesting because they want to go back to work, because they want businesses to be open, that they should just be allowed to die, don't be silly. That is ridiculous. Everyone, whether they're foolish, whether they're careless, whether it doesn't matter. They're all humans. And they are all children of God, and every single person deserves the utmost care and respect, and their lives should be all equally respected. That's my personal view. Here's a scene from Pennsylvania, Harrisburg, another protest. These are all protests that have been happening today or yesterday. Here you go. More craziness.
Hello there, I'm Miguel Marquez on the steps of the Pennsylvania Capitol building here in Harrisburg, Pennsylvania. This is an unofficial event that officials say should not be happening today. It is officially or ostensibly a reopen Pennsylvania event, but it feels very much like a re-elect Donald Trump event as well. I want to show you around a little bit. The event itself has just gotten underway, but people have been gathering here.
See, this is not responsible. You that can't see this, I want you to know that if you're listening to me on the radio right now, that these crowds are just like pre-pandemic crowds at any protest, any rally, any march, any parade. This is not social distancing. These people are not wearing protective masks. They're not taking what the doctors, what the healthcare professionals, what every sane, logical person protecting your lives is telling you. Okay? And just to go back to some of the comments, I want to keep you guys all engaged. I'm having tons and tons and tons of comments. I apologize. I can't get to every single one of you, but I do want to address some of the things that you guys are saying. Rachel says, they want us to stay home because the nurses and the doctors can't take the load. These people are idiots. They're just selfish, and that's what I'm talking about. I wouldn't want none of their hairs. And they've been in a crowd like that. A week later, they're sick.
Yep.
Here is another comment from Amanda Wallace. This is what happens when the government takes so long to help people after making them stay home. Yes, Amanda, that's a very good point. People have been waiting for so long. Our government has not acted quickly enough. People have been dragging their feet on Capitol Hill and getting things passed and getting the stimulus money and getting us the loans. The employment, unemployment stuff is a mess.
It's all a mess, and that's the whole thing, is that giving people a glimmer of hope to help us through the situation and then not delivering on it. That whole first wave of the payroll loans grant, it's not, the money's not there anymore. It's all gone. It went to a whole bunch of companies. People are still waiting for the stimulus check. I understand people say, I'm not getting any money to even buy food right now. I've got to go make some money, and I can't. I understand that frustration, but it's like it comes from the government, slow movement, the slow movement of our government. I mean, I totally agree with you.
Rhonda says, I'm 61 years old with COPD. They ain't going to want me to stay around. They're trying to kill the elderly. Well, I don't know if I would go as far as to say they're trying to kill the elderly, but they definitely aren't doing anything really to stop it.
Yeah.
They're not They're not making a concerted effort that I can see. They're kind of just like, kind of shrugging their shoulders like, I guess the old people are going to die. And I guess we're okay with that, which is really perverse. I mean, when we first heard this kind of rhetoric coming out, there was a lot of folks that watch my show. I mean, I do have a lot of people over the age of 50 and women in particular that watch my show. And I just want to say, I value every single life, especially those of our elders. I do. And I think that we have to show that, and we have to show with our actions that we live the values of caring for the elderly in our society. Because if we fail them, we will never live that down. Let me show you another scene. Here is yet another protest in yet another city, and it's just crazy.
Hey everyone, Hannah Bueller here for you. I'm going to take my mask off only because I'm not around anyone here and I want you to be able to hear me. We are in Niagara Square right now where I can't even estimate really how many people are here. They are protesting the governor's order, the pause order, extending that pause order until May 15th. And these people are fired up. I want to show you what I'm seeing now. This is a rolling protest, so people are not getting out of their cars here in Niagara Square, but they are trying to send a message to Governor Andrew Cuomo, basically saying we cannot continue to be in our homes and not at our places of work until May 15th. That is directly coming from the people that are organizing this protest called Gridlock, Western New York. There is just a number of people here in Niagara Square is at a standstill. Just in the time since I have gotten here, I have seen a number of law enforcement agents start to come here on scene to try.
So, folks, I guess I applaud these folks for staying in their car. They truly are. They don't have a bunch of people that are. So I guess it's a little bit more responsible. But, folks, come on. Let me just tell you, the reality is that we want in this blame game to give these governors an out and to point the fingers back at society so that in the end we will have no one to blame for all the deaths but ourselves. And the truth is, we have to take personal responsibility. We have to take the bull by the horns here and say, okay, how much of this is real? How much of this is an illusion? How much of this is bought and paid for? Who put these folks up to going out long before the recommendations of even the President of the United States and the medical experts and the governors of these states? They're preempting the decisions of the governors of the states where they're saying, this is what we're going to do. Now, if you don't like the particular rule of your governor of your state, I told you, there's ways to deal with that. You can also get rid of them in the next election cycle, right?
Right.
Vote them out. And let me tell you, a lot of politicians are not going to survive this pandemic. Their political careers are going to be kaput because of how they handled this pandemic. Believe me, because nothing will get you out of office faster than a whole lot of death. Nothing. But for whatever reason, we need to shift that blame. And I believe it's for this particular reason, okay? This is my opinion, right? Everybody has a right to their opinion. If you have a different opinion, you're welcome to share it with me and with my audience. I'd love to hear it. My opinion is that we are doing this. What you're seeing, the theatrics of everything you see before you, is a way to shift the blame so that the government, the governors, don't have to hold any of that blame. Or at least they can deflect it and say, hey, we're not liable here. We're not responsible for all this death. You, the citizens, the community, bear a large burden so that nobody has recourse when those bodies start piling up. So that people can't sue the government, can't sue the governor, can't sue for wrongful death. And believe me, remember what I told you. I was a trained paralegal before I started doing media work. And I'm telling you, This is not a man-made disaster. I mean, this is not an act of God. This is a man-made disaster. Okay? So there is liability to go around. Believe me, the president's already thinking about it. People are already tabulating how much this is going to cost them and who's going to pay for it.
Yeah.
I promise you that's going to happen. So why on earth, if in a red state like North Dakota, where the governor's already basically never gave an order to stay in place, to stay at home, and never intended to, and is already opening up the businesses that they closed for safety reasons, why are we having a protest? I don't know, but here it is. And these people are all milling around. As you can see, they're walking around. Some people are driving in cars.
Yeah.
This is a mix. I mean, you guys, North Dakotans, can you please decide? They're like, some of us will stay in our cars and act safely, and
The rest
some
will
of us
stand on the Capitol steps
I don't understand.
and fly some flags, and it's really windy there.
I don't get it.
Yeah,
Someone please explain to me why we need that. We don't.
definitely.
But here it is. So I believe that the real reason for these theatrics is to give cover for governors who decide they're going to open tomorrow.
Well,
they're going to, yeah.
that's very interesting. It's very, very, very interesting perspective.
What do you think?
And we're airing, Cindy's right a lot. Most of the time, Cindy's right. Her predictions, things she says, they come true. And most of it's based, and all of it's based on facts and receipts. Sometimes we project some of the things. You're listening to KPPP LP 88.1 Fargo Moorhead, adding local color to your airwaves.
Alicia Martinez Velasquez comments, there's already a group in Florida suing China. Get in line. Everybody's going to be suing China. Yeah. Everyone. Folks, let me also share with you this disturbing video of how a mom is having her kids get in on this, going to a playground and having the kids tear down the tape that's been put up to protect children from getting the virus and spreading it. Take a look at this. They're ripping the tape. Oh, can you rewind that?
Yeah.
Because we missed the beginning of the video, and I want you to hear what they are saying.
We are freedom. This is for freedom. Dangerous freedom.
Dangerous freedom.
Jeez.
We need to stop asking permission.
Yeah. We need to start doing it ourselves. America's coming back together.
We the people.
We are the people. You better take down all of this caution tape, or nobody will be able to be on the things, because people will think, oh, they're not going to be on it for a long time. Like, the kids won't be able to.
What happens when kids don't get to play and live free? What happens?
They get bored. They get bored and they go violent. They get mean.
They get mean? Yeah. Is it good for your health?
No.
Yep.
I'm going to destroy everything.
Are you afraid of catching coronavirus from this playground equipment at your old school?
No.
Okay.
So if your kid wants to go and jump in a river with the wrong, really strong current, like the migrants were doing, and throwing themselves into the Rio Grande River, knowing their kids don't know how to swim, knowing the parents don't know how to swim, you're going to ask the kid and be like, hey, are you afraid of drowning since you don't know how to swim? And if the kid says, no, or you train the kid to go, no, I want to be free.
Yeah,
and I'm going to swim across that river.
Yeah.
It's okay to do, because that is exactly what was happening, and people were appalled and disgusted and said that those parents should have their kids taken away.
Mm-hmm.
What mind has a child answer for themselves? The child is not of an age where they can consent to being exposed to a deadly virus. The mom is. The mom is the one that has to decide what's safe for her children, not the children. Oh, well, he said he's not afraid of getting the coronavirus, so I let Billy go ahead and lick the slide.
Yeah.
I don't care. He's not afraid, so I'm not afraid. Folks, This is ridiculous. What do you think, Duke? Do you
What?
think that's the normal for you to go and
No.
put other? Why does this mom have the right to make the other kids sick?
I know, and it's making me really angry. Actually, your show's making me mad.
Why?
You know, because you're showing these idiots, and the kids like, this is our freedom. You know why? Why? Because we get bored, and then we turn violent. The kid says.
We turn violent.
We turn violent.
What?
Because they're bored.
So that
it's like
justifies.
there are some people have problems with their kids. Their kids haven't been disciplined. They haven't been parented, and it's really showing up in a lot of people's lives right now because they've had their kids be raised by institutions and not the actual parents.
The mother that posted this video, by the last name of Sheldon, said that what is happening and she was referring to the playgrounds, is tyranny. She called it tyranny. Not being able to play on the playgrounds and having to stay indoors to not infect, and kill a vulnerable part of our population is tyranny to you?
Yeah.
Really? She said, we must stop asking permission, live dangerously. But you are putting the lives of other people in danger. That's not fair. You shouldn't get to take the lives of other people and put them in danger. You don't have the right to collapse the whole healthcare system because you want to make sure your kids can play on the playground.
Exactly.
It's not the way it works.
Mm-hmm.
She said, since when is playing non-essential? No one said your kids can't play. They just can't play in the shared public spaces because that's what was determined for your town. Less than 1% of our people get this virus, and of those, 99% recover. This is tyranny. We the people do not consent. Freedom is essential, people. He's just doing his job. The Nazis said the same thing. Let our people go. She's referring to a man that was the security of this particular playground, which is a private property. And I think it's like the schoolyards one.
Mm-hmm.
And they came out and told her she couldn't do what she was doing and that she needed to leave.
You're trespassing.
And she basically said, I don't care. Basically, I'm going to do what I want to do.
Yeah.
Then I want to share with you what else is being put at risk. Children that are susceptible, like this 5-year-old who has a rare complication and dies of COVID-19. She's the first child to die in Michigan. These are the kinds of things that we shouldn't have to see happening.
Yeah.
We shouldn't have to have elderly people die either. And let me just share with you that this idea that if you just go out and you get it, and you have a party and y'all lick a COVID doorknob, then you'll just get it over with and then you'll get herd immunity and we'll be done faster. Well, let me tell you something. In this Reuters article, it was revealed that the World Health Organization is unsure that antibodies protect against COVID. There's actually little sign of herd immunity.
Wow.
So if that's what you were waiting for, you may be in for a very rude awakening. Okay, folks?
Mm-hmm.
Here's the reality, okay? This is an image that was posted by a medical worker. It is an image of a medical worker. You can't tell whether it's a nurse or a doctor or what, wearing the full gear, the goggles, the head thing, the mask, the gloves, their gown. And in there and behind them is a crowd of people cheering them, clapping and clapping and clapping, as also their back of the doctor is stabbed full of scissors in the back, stabbed full of scissors. And this is what the person that posted is named Melissa. I'm going to keep her last name private, but this is her Facebook page that she posted this from. She is a faculty and surgical physician's assistant at Oregon Health and Science University. So this is coming from a doctor currently working under the stress of this pandemic that posted that image of the doctor with the back being stabbed full of scissors. A doctor that has their whole back stabbed full of scissors. If you could put up that image for just a minute. This is what she wrote. If you were active in the protest in Lansing, and I'm sure she feels this way about any protest, or were in support of it, then you should be made aware that you are the problem. You are a public health risk and a menace to your community. Furthermore, I don't ever want to hear you call another healthcare worker a hero. We don't want your thanks and your prayers and your accolades. We want your respect. We want your cooperation. We want your abidement of public safety guidelines. Compliance is our safety. Compliance is the thanks. Compliance is the help. That's how you help. All of this means nothing if you fill the hospital with dying people and overwhelm your healthcare workers. It means bupkis. It means zero. It means zip. It means nada. That was my additional narrative. Now I'll go back to what this doctor said. You fly in the face of every healthcare worker who has stretched themselves to their limits caring for people who share the same government that you do. You were not exercising your right as a US citizen to protest under the Constitution. You were exercising your hatred of your governor. You were bulking up your ego with anger, inspired by a pseudo threat, a fake threat, a perceived threat that's not real to your quote unquote freedoms. You were demonstrating that your self-inflated and flawed opinion supersedes public safety and the lives of others. What you do is block ambulances on their route to level 1 trauma centers and hospitals. You forced cancer patients to miss or cancel their appointments, to delay people's therapy. What you did is flash your arrogance and entitlement alongside your ignorance. You ignored social distancing guidelines, preventative measures, and safety precautions, directly placing your community, your family members, and each other at higher risk for infection and spread of SARS-CoV-2. This is not how you thank your heroes. This is not how you treat people as disposable entities. Our friends and family are dying. And if you or your loved one ends up in the ER without an ICU bed or ultimately on a ventilator, we snowflake medical personnel will rush in to save your lives like a fierce blizzard that we are, and hold your hand as you die. Or hold your phone in front of you while you FaceTime your family to say your last goodbyes. People will die alone because of people like you. Hashtag with all of these hashtags. I am a healthcare provider. Stop complaining. Stay at home. You have a right to peacefully protest. But we will pay for your protest. Social distancing works. Can't enjoy your rights if you're dead. Your right to go boating is not above our lives. Credit illustration Luis Quiles. So why is this notion, when we brought it up before, when governor of deputy governor, whatever he is of Texas, says I would be willing to die for the economy, when we had people floating the idea it's okay to kill grandma and grandpa, I mean it's just grandma and grandpa, maybe grandma and grandpa want to die for the economy. Nobody liked it. It stunk to high heaven.
Yep.
When the doctors came out, the Oz, the Phil, the Pinsky came out and had to, distance themselves from their statements. Oops, I misspoke.
Yeah.
Whoops. I offered up grandma and grandpa to the economy. It didn't sit well with anybody. People got angry. So why is this idea still being floated that we should just sacrifice our elderly and kill our elderly? Why do we think it's okay to kill grandma? Because we think, and we've said, and we've heard it be said, that they are not contributing. I mean, they're not really contributing to the economy. They really don't do anything, right?
Oh, boy.
Well, you're wrong. Let me tell you, I'm here to tell you, you are wrong. Nationally, Americans age 50 and older, and this is from a Washington Post article that I must share with you, my listeners. 50 and older, that is 35% of our total population in America, 35%, y'all, account for 40% of the U.S. gross domestic product. That's nearly half of the gross domestic product of the United States, or $9 trillion as of 2018. They also contribute 43% of American taxes. One reason their economic footprint is so large is that older people, contrary to their popular conception, are not only consumers, but producers. Americans age 50 and older have more than doubled their presence in the U.S. labor force since 2000 and now account for 7% of it, a figure that climbs to more than 23% if you lower the bar to age 55. Today, workers in that age group occupy critical positions throughout our economy. 22% of U.S. construction workers are 55 and older, as are a quarter of manufacturing positions. How about farmers? Those critical essential workers that we need to eat and survive. Well, critical figures, they are very critical figures in any economy. Well, they are nearly 58 years old on average. On average. Farmers age 55 and older manage 2/3 of all U.S. farmland. And much of that land is found in aging rural communities like North Dakota, where the people that are older outpace the number of new live births. Rural regions that have not adopted social distancing rules, like North Dakota, Iowa, the second most agriculturally productive state after California, has lagged behind other states in instituting social distancing rules, as has Nebraska, another agricultural producer. Number 4, Texas producer, number 3, waited until April 2nd to institute statewide protections long after most other states had made the shift, and they're planning on reopening next week. Next week. Nationally, 16% of Americans are older than 65, but in rural areas. The figure rises to 19%. 19%, nearly 20% of the population in rural states are older. Such areas currently tend to have fewer confirmed cases of COVID-19 per residents than their more densely settled counterparts, but their older populations and more lax rules put them at a higher risk of serious outbreaks. Mm-hmm. Should older residents in those areas fall sick in disproportionate numbers, regional economies will be devastated. Farming, for example, often depends on seasonal, time-dependent periods that can't be put off. Either the work gets done or the window closes. The best way to make sure the agricultural workforce remains healthy in the vital weeks and months to come is for rural states to embrace social distancing measures now. Mm-hmm. The healthcare industry, how about that? Well, more essential than ever during a pandemic, they are also an aging field, particularly so in rural states. Nationwide, nearly 1/3 of practicing physicians are 60 and older, and nearly a quarter of registered nurses working in hospitals are older than 55. The numbers skew older in rural areas, and there are fewer doctors per capita there too. The same is broadly true of physicians' assistants and nurses. The rural healthcare workforce, already under stress, will be disproportionately sick if state and local governments don't more firmly embrace stay-at-home orders. Older Americans also provide an outsized share of informal caregiving. Grandkids, the caregivers, both in rural areas and nationwide. Such caregiving supplies about 470 billion with a B in unpaid labor each year, according to some analysts. If that population were to get sick, that could set off a domino effect in which younger people must leave the workforce to assume caregiving responsibilities while shouldering major unplanned for expenses. As is the case of rural counties, the demographics of the nation's retirement meccas, retirement states, make them particularly vulnerable to COVID-19. Arizona, I'm looking at you. What's more, they lack the Florida, I'm looking at you. They lack the advantage of low population density. Some of these retirement destinations are taking the new coronavirus more seriously than others. As of Sunday, Maricopa County, Arizona, home to such retirement-centric communities as Scottsdale and even more Sun City, received a D+ in social distancing rating from Unicast, a company that has compared cell phone mobility data from before and after the coronavirus outbreak to see if people are actually staying at home. Florida, the Villages, a whole city full of old people, has the largest retirement community in the country. It is doing even worse. The Villages sprawls into Sumter County as well as an adjacent Lake and Marion counties, and those counties currently hold a D- and D, respectively. Major retirement communities can be regional economy juggernauts, creating jobs ranging from nursing to construction. Anything that hurts them will also grievously hurt their surrounding communities. Both Florida and Arizona trailed the national movement of instituting stay-at-home orders statewide. But in a crucial stretch of days in the end of March, Arizona fell in with that nationwide trend, while Florida's Governor Ron DeSantis pursued a policy largely focused on keeping people from such COVID hotspots as New York and New Orleans out of Florida. We are witnessing the cost of that delay in infections and in lives. The current geographic variations in stay-at-home orders is deadly. And although older people and other at-risk groups will pay a more severe price, everyone stands to lose. That is the reality. So rather than just freaking out, blaming, and not taking personal responsibility, we need to have logical, rational minds right now and do what is best for the entire country. Folks, I now want to go to the video of Yuan Lee. We're going to translate what Mr. Lee says. Remember, this is a man who is living in Spain. He speaks Spanish, so I'm going to be translating what he says, and Duke will be starting and stopping this for me. Let's get ready.
Muy buenas a todos, ¿qué tal? ¿Cómo estáis? Bienvenidos, soy bien. Hoy en este video quiero comentar una historia de una política española.
Hello, my name is Yuen, and I want to tell you a story today about a Spanish politician.
Macarena Olona.
Her name is Macarena Olona.
Sabemos que la semana pasada me estaban insultando, amenazando muchísimo en la red social china, sobre todo dirigida por la embajada china.
Last week, I was being heavily insulted and threatened by the Chinese social media that is run by the Communist Party in China. The Chinese embassy, in Spain.
China. Y ahora pues le toca a otra persona, así que yo.
And now, I guess it is someone else's turn to be hated and threatened.
Yo siento que no estoy solo. ¿Quién es? Es Macarena Olona. Es la portavoz de un partido español, se llama Vox.
The other person that is going to receive all of this hatred is a Spanish politician named Olona, who is representing the Vox Party. Is the name of a party in Spain.
¿Qué pasó? Pues la señora Olona hizo una entrevista anteayer en la cual nombró el nombre como la peste china.
She was interviewed on a media platform last week in which she said that this is the Chinese plague.
Entonces la embajada china se enfadó, las espías chinas se enfadaron.
And the Chinese embassy became very angry, and Chinese media became very angry.
Entonces empezaron a insultarle, incluso hay como comentario como que se vaya de España.
And they began to insult her and say things like she should leave Spain.
Pero ¿qué estás diciendo? Ella es española. Está en su país, España.
What are you saying? She is Spanish and she's in her country, which is Spain.
Que se vaya. ¿A dónde? ¿A China? Que seamos lúcidos, que seamos...
Where's she gonna go? China? Let's be lucid. Let's be rational.
normales, ¿vale? Con nuestro pensamiento, digamos, básico. Entonces, la verdad, yo entiendo el caso perfectamente porque yo he estado y aún no se ha acabado.
I understand her position completely because I have been there and I am still there.
Conmigo, ¿no? Desde aquí, antes de decir nada, yo quiero dar las gracias a la señora Olona. ¿Por qué? Porque lo que dice es la verdad.
Before I go any further, I want to thank Miss Olona. And I want to do it because what she is saying is the truth.
Es una persona que yo le tengo todo el respeto mío a ella. ¿Por qué? Porque ella es una política. Cuando hablamos hoy en día de los políticos,
I have complete and total respect for her because she is a politician. And today, in today's terms, when we talk about politicians,
gente dice, vaya, que todo es mentira, no queremos saber. Pero ella, enfrente de una dictadura, de un poder, digamos, fuerte, ella se atreve a decir la verdad.
But we say about politicians, they all lie. That's all they know how to do is lie. But this politician, this woman, confronted by a dictatorship of a communist country, she still has the courage to speak the truth.
La verdad es una persona increíble, muy valiente y ha cambiado mi opinión hacia los políticos.
I believe that she is very courageous, and she has actually changed my opinion of politicians.
He cogido 30 segundos de esa entrevista y en ese tramo ella nombró la peste china. Vamos a verla.
In this interview that she gave, Macarena Olona, she called the coronavirus the Chinese plague.
Está en riesgo y se está desangrando.
Spain is in danger and it is bleeding out.
El causante no es el coronavirus.
And the cause of that death will not be the coronavirus.
Es este gobierno social comunista, porque
It is this socialist communist government.
China nos ha traído dos cosas.
Because China has brought us two things.
En primer lugar, la peste del siglo.
The first is the plague of the 21st century.
21. Y en segundo lugar, el caldo de cultivo propicio.
And the second one is the cultivation of
para que los postulados comunistas que no
a cultivation of an entry for communism
han sido votados por los españoles.
That is controlling our politics that no person in Spain voted for
Mayoritariamente se
by a majority of its people.
pongan finalmente en nuestro país. Esa es la gran desgracia que
And they have installed them in our government.
estamos viviendo y cuyo causante, reitero, no es el coronavirus.
And that is the cause of why our country is bleeding. And that has nothing to do with the coronavirus.
Creo que no hace falta muchas palabras. Nosotros
Well, I don't need to say much about that.
entendemos que la señora Olona se refería al Partido Comunista Chino.
We can clearly tell that Miss Olona was referring to the Communist Party of China.
Aunque habla del China, del país China. Entonces, ¿qué pasó? La embajada china aprovechó de
Even though she referred only to China as the whole country. But what happened afterwards was the embassy of China then
de esta brecha, para meterle una etiqueta como anti-China a ella.
they wanted to paint her as a racist that is against Chinese.
Entonces, desde aquí yo quiero dar un consejo a todos los políticos. Cuando en el futuro nombramos el Partido Comunista Chino,
So, because of the way that she is now being portrayed, I wanted to give a suggestion to all politicians for the future for when they refer to this virus and when they should be talking about the Communist Party of China.
mejor utilicemos el nombre del Partido Comunista Chino.
It's better to say the Communist Party of China.
Hay tres conceptos que tenemos que tener claro. Uno es China. China es un país.
We have to have three things very clear. Number one, China is a country.
Es un país enorme, es un país con mucha historia, con 5.000 años de la cultura.
It has a long history. It has 5,000 years of tradition and culture.
Increíble. El pueblo chino es un pueblo muy, digamos, diligente, inteligente, trabajador.
The Chinese people are people that are very strong, very hardworking, very good people.
Es un pueblo maravilloso.
They're wonderful.
La tercera cosa.
The third
el
thing.
Partido Comunista Chino.
The Communist Party of China.
Es un poder, digamos, ilegal y en un país democrático.
It is an illegal power
Dictadura que persiguen
that masquerades as democracy, and they persecute their own people.
a sus propios pueblos. Entonces, bajo el sistema del Partido Comunista Chino, el pueblo chino, la verdad, sufren mucho, son víctimas.
Under the dictatorship of the Communist Party in China, people suffer a lot.
Entonces, desde aquí, les quiero transmitir este mensaje a los políticos, pues a los amigos también que están viendo este vídeo.
So I want to send this message to all the politicians and all of the people that are friends that are watching this video.
China es un país, el pueblo chino es un pueblo maravilloso, pero
China is an amazing country. The Chinese people are amazing people.
el Partido Comunista Chino es un poder perverso.
The Communist Party of China is a perverse group.
Que persiguen a todo el mundo, que tengamos claro. Otra cosa muy...
They persecute people on the entire planet. Let's be very clear about that.
Ridícula, porque después de la entrevista de la señora Olona, la embajada china en su Twitter escribió una frase.
So after the statement, the interview with Miss Olona, the embassy took to their Twitter to write this statement.
Como echar la culpa a los demás es un virus del siglo XXI.
Why blame somebody else? It is a virus of the 21st century. And this is what the tweet says of the Chinese embassy. It says, image of the day, hashtag image of the day, the political game of blaming others for the plague of the 21st century. They're actually referring to the quote that was given by Miss Orona.
Pero, ¿qué dice? Porque justamente este mensaje te refieres a ti mismo.
So, what are you saying? This statement is really referring to yourselves.
Porque desde el principio, el Partido Comunista Chino ya intentó echar la culpa a Estados Unidos.
Because right from the very beginning, the Chinese Communist Party attempted to put the blame onto the United States.
Pues luego se enfadó y luego pues echó la culpa a Italia.
America fought back. They were very angry about it. So then what did they try to do? They tried to blame Italy.
Y ahora parece que quiere echar la culpa a España.
Now it appears they would like to blame Spain.
Esto, la verdad, es irónico.
This is truly ironic.
Hablar del pueblo chino, esta mañana me pasaron una foto, un amigo chino.
This morning, a friend of mine sent me a picture. He's also Chinese.
Después de ver esta foto, la verdad, a mí me duele muchísimo el corazón, porque
And after seeing that photo, I have to tell you, my heart hurts.
es como un mensaje que se pone, es un papel que se pone en una...
It's like a sign, a notice that is in Spanish that's been put out, and it says, the Chinese government is responsible and culpable. Since 2015, they were playing with mortal viruses. This is a terrorist war of biological weapons to control economically the entire planet. Reject and boycott any Chinese products. Let them eat their baratijas, which is low value crap, basically. And remember all of the dead innocent people. Okay.
Tienda. Dice, pues, rechazar como el pueblo chino, dejar de comprar con los chinos, algo
And
así.
it basically is telling you to boycott China.
Quiero ponerlo sencillo, la culpa del Partido Comunista Chino, ¿por qué tienen que pagar el pueblo chino?
And I want to put things very simply. Why do all of the people of China have to pay for the sins of the Communist Party of China?
Es que ellos son víctimas. Ellos sufrieron en China.
You must understand they are victims of the Communist Party also in China.
Entonces salieron del país para buscar una mejor vida, una vida más tranquila.
If they fled the country, they did so to seek a better life, a more tranquil life.
Más pacífica. Y difícilmente durante estos años ha conseguido su vida en España. Y ahora por la culpa del...
And with great difficulties, they have made a life for themselves in different countries like Spain.
Partido Comunista Chino. Le rechazamos afuera. ¿Esto es justo? No lo es. Según Partido de España, también ha cometido un error grave, atañado a...
Is that fair for the Communist Party to have control over them? If a party in Spain makes a mistake,
otro país, y luego dice este país, pues rechazamos a todos los españoles.
And it then says we reject all people of Spain.
Esto a mí me parece no es justo.
I think that would be very unjust.
La culpa pertenece a la embajada china, al Partido Comunista Chino.
The fault is the culpability here belongs to the Communist Party of China, the embassy of China.
A la OMS, si queremos hacer
The blame belongs on the World Health Organization.
manifestación, podemos ir a la embajada china de una forma, digamos, lúcida. Claro, estoy hablando del pueblo chino, pero hay un tipo de persona.
We have to think logically. Okay, so of course I'm speaking of the people of China.
No está incluido, que es la espía china, que están trabajando con la embajada china.
I also have to make mention of the Chinese spies that work for the embassy.
Con el Partido Comunista Chino y un mundo democrático. Esto es
They work for the Chinese Communist Party.
una amenaza para todo el mundo. La espía
And they pose a threat to the entire world. Chinese spies.
China no está incluida, ¿vale? Pues nada, para acabar con este video.
Chinese spies have not been included in the conversation. Okay, well that's it. To conclude this video, I would just like to end. Can you go ahead and finish the video?
Oh.
I'm translating what he said.
3 frases. Ánimo China, ánimo el pueblo chino, pero adiós el Partido Comunista Chino. Muchas gracias, hasta la próxima.
Keep the faith, Chinese country, Keep the faith, China. Keep the faith, Chinese people. And goodbye to the Chinese Communist Party. And that is the end of the video. I'm going to be bringing you more from Yuan Li. He has very interesting, eye-opening videos in which he exposes very, very well what is going on with the Communist Party of China. And just to give you a little levity for the day, take a look at these penguins in Cape Town. They're just out for a walk, walking around South Africa because there aren't people. Social distancing is keeping everyone in their homes, and they're just going for a stroll. I love how they wait for the other one to cross the street. This guy he's the leader, obviously, but he's going ahead of the other two. The other two must be a couple, but he stops and waits for his friends. There he is stopping. He's like, "Come on, guys, catch up!" And he takes off running.
Yeah,
and they just kind of follow him wherever he goes
into the sunset.
There's like a crosswalk. I wonder if they use the crosswalks like humans.
Penguin crossing.
It's so funny though because they look like rich people out in their tuxedos just prancing along. Well, folks, I hope that this has been an informative show. I'm going to be bringing you more on what is happening with the global pandemic on my next show here on A Mexican Crossing Lines with your hosts, Cindy Gomez-Schempp
and Duke Gomez-Schempp.
You've been listening to 88.1 FM KPPPLP Fargo-Moorhead, where we are adding local color to your airwaves. I hope you have a very pleasant today and an even more pleasant tomorrow. God bless and good night.